Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.
Jeff Fahl of Phillips is the Republican candidate in the 74th Assembly District. Jeff, thanks for talking to WisconsinEye.
Thank you, Steve.
On your campaign website, you talk about unemployment statewide maybe under 3%, but it's 6% in your area?
Yes, when I looked a few months ago, it was quite higher. In my district's made up 4 counties, and so it's the Price County where I live is actually doing okay, but it was the northern counties where their unemployment is a little higher.
And what are your thoughts on how you as a member of the Assembly could help lower that unemployment rate?
Well, and that's one of my top focuses is economic development and finding jobs. And so I want to try and bring more jobs to northern Wisconsin. But then there's also the just working on worker training and getting those people that don't have a job the right skills so that they can find a job that already exists.
Okay. Let's talk about healthcare in northern Wisconsin. What are your thoughts on how we can maintain and expand healthcare in rural Wisconsin?
Well, I guess there's the part where just recruiting, doctors and nurses, and I think that's just like any other the economic development where we need jobs. And to me, it seems like a big factor that's restricting the growth in northern Wisconsin and in the rural areas in general is internet access. I had an example. It wasn't the medical profession, but I'll say it was a lawyer was looking at college. The example I had heard was looking to bring students up to work at his law firm, and he had a bunch come up from the Milwaukee area, and all of them, I figure it was 4 or 5 of them, they pretty much ended up saying, well, we don't want to live up here because the internet access is too slow. So I think we need to try and improve that, not only to improve the current speeds, but to expand it to the rural areas.
Is access growing to the internet in the rural areas? In other words, is it better than it was 5, 8, 10 years ago?
I'd say yes. Yeah, I mean, I think the companies that are here that are providing the service, an example for what's happening in my area, our local small provider is actually running fiber optic throughout Phillips. In fact, I think to the areas they cover, I shouldn't just say Phillips, I think Prentice and Park Falls too. And they've gotten a grant from the state to do some of those projects. So I think they see, and I think other companies I'm sure also see the need to expand that. So there's already progress being made.
Back to healthcare, are you hearing from hospitals and medical providers that our Medicaid reimbursement rates are too low in Wisconsin? And if so, are you afraid we're at a tipping point that threatens health care under our MA program?
I haven't heard specifically that, but looking online, I have seen that that's an issue. And I guess I don't know what the exact answer is, but I guess part of a solution I would say is to get people off of you said Medicaid, right?
Yeah.
Yeah, to get them off the Medicaid. And by doing that is to give them good paying jobs. So it's all the vicious cycle of the economy and jobs.
There's a pilot program between state government and Delta Dental that provides low-income residents with dental care. It's a pilot program. Have you heard enough about it to know whether it should remain a priority of our MA program?
I haven't really heard a lot of specifics, but I will say, I think dental care is as critical as any other part of the medical care. So I think it should be covered through the current medical programs that we, Medicare and Medicaid.
As you campaign, are you hearing about an issue with caregivers? AARP estimates that 578,000 Wisconsin residents care for a family member or a neighbor. So my question is, would you support laws or rules that require hospitals to recognize and work with caregivers when someone they love is hospitalized? Has this issue showed up as you campaign?
The caregivers, no, not really. But I think if we can keep the people in their homes and give them that option, I think that, to me, sounds like a good idea to let them stay at their house.
As a former mayor of Phillips, you're aware of the debate over levy limits?
A little bit.
Yeah, a lot.
Yeah.
We've had them for 14, 15 years,
Mhm.
and some local government leaders saying, hey, they hurt our ability to provide local services. Keep levy limits to control property taxes, dial them back, or get rid of them?
Well, that's a tough question, because I have two opposing ideas on that, because I went through it, and it is very restrictive. But on the other hand, I also am a believer that we need to maintain taxes. I think that they've been pay too much. So the levy limits have been out there for quite a while, and it's been kind of low. So I could see maybe some sort of a small relief on the levy limits. Perhaps even looking at some, because I think what I've heard is that it penalized those that had been good prior to levy limits,
Mm-hmm.
and so they were keeping things low, and then all of a sudden they were stuck with the low limits, whereas those that were spending like crazy, they had the higher budgets, so they could potentially, I'm sure this isn't the case all the time, but they could manage the limits a little better. And I know the limit does allow for higher percent if there's growth. I believe, at least it did back when I was mayor. Unfortunately, the issue that we're seeing in the rural areas is they're not seeing the growth, and so they're stuck at the lower number versus the other areas that are seeing growth and being able to go a little with a higher limit. So I guess to pretty much summarize, yes, I think there should be a little bit of relief, and it should be reviewed.
The impasse, the gridlock in the capital over how we pay for highways, bridges, maintenance, and construction, how would you like to see it solved?
Well, I know this is leading to the fuel tax and toll roads.
That's part of the debate.
Part of the debate,
Yeah.
right? And like I had said, I'm opposed to raising taxes. So
So no to a gas tax increase.
well, it's not a hard no. I'm a realist too. I realize that sometimes there may be the need, but what I'd like to see is, I think we need to focus for road projects is, instead of increasing revenue, is finding ways to save money on the current projects. And the company I work for, a manufacturer, they've done lean manufacturing, and they've done it for many years. And even now, we're still finding ways to save and eliminate waste. And I think most people would agree that there is that potential to do the same at the state level. I know even when I was mayor, and we would do projects, and some of the citizens would hear how much we had to pay for building whatever it was. They were like, that's just crazy. What, I could do that for half. And I'm like, well, then do it for half. But so I think even that was 10 years ago, 8 years ago. So I definitely think there's room for eliminating waste.
When you campaign the 74th and the issue of tolling comes up, what are you hearing? What's your position?
I don't believe I've had anyone actually make a comment on the tolling.
Okay.
I think the issue with tolling is that it's also very expensive to implement. So I don't know that it's a solution that we should consider. I guess we should always consider all ideas, but I don't know that it's going to be a solution that we would be able to implement.
The record tax breaks, tax incentives given Foxconn is one of the reasons that Kimberly Clark has asked for the same type of tax breaks and tax benefits.
Mm-hmm.
The larger question is, when should state government help private companies? What's your thought on that?
Yeah, that's a slippery slope. I think it was good to that we can bring Foxconn in, and I like the fact that the the incentives were conditional, so that they have to provide the jobs and the infrastructure before they get the incentives. You know, I hate to see any company move out of the area, and I guess it's just a matter of balance of what this state or the area what benefit they would receive versus what it would cost to keep that company. And if it would cost too much, unfortunately, then I don't think we should do it. And I don't know exactly what Kimberly-Clark is asking for, so I can't speak to that exactly, but it's all a matter of whether or not it would be advantageous to the state to do that incentive.
The current state budget included more than $600 million more in state aid for our K-12 public schools. When you talk to local school administrators and superintendents, and they say, thank you very much, but we need another major increase in the next state budget. Do you agree? How well funded do you think our public schools are now?
I think our schools are doing well. The big thing that I've seen, and primarily I guess since I live in the Price County area, the schools in Price County, and I know both the Phillips and Prentice districts did referendums for the buildings. And so it seems that they're able to maintain their day-to-day expenses. Operational expenses, thank you, yeah. But it's the buildings that they're struggling with. And so I know the Prentice referendum passed, the Phillips referendum failed. And so I know Phillips still needs to is looking at their elementary school. So I think there's still need at the schools for funding, but they do have the tool through a referendum that if the taxpayers do see the need, they will approve it.
The choice program, the voucher program, has expanded, started out in Milwaukee, now we're seeing it's statewide.
Mm-hmm.
Should it expand further?
Yes.
Okay. Why? Because?
Well, I believe that it's the parents' responsibility to, obviously it's to raise their children, but also to educate them. But it's common that we send them to a school so that, because it's easier to have one person teach all than every person teach their own children. So I think it's their choice to where they want to send their children for school, whether it's a public school, a private school, homeschool, any other options that are out there. So I think it should be the parents' choice of where they send their child.
A big item of debate in the next state budget will be whether we need a new state prison. Waupun and Green Bay were built in the 1800s. Some Democrats who ran for governor said we should be thinking about ways to cut our inmate population by half. Do you think we need a new state prison?
Well, I don't know what the condition of the current ones are. That's a pretty old building. But I don't know. So if they're talking about a new prison to replace them, maybe. I think we need to look at. We have too many prisoners. I agree with that. I did some searching, and they said Minnesota has less than half the prison population of Wisconsin, and there are other states out there that are finding other solutions rather than building walls in prison for the prisoners. So I think we need to look at what other states are doing, and to me it seems like it comes back to technology of finding other ways to make sure that the prisoners pay for their crimes, but also at the same time that the public is still safe from the prisoners.
UW system budget. We've had a freeze on resident undergraduate tuition for 6 years. The governor wants it to expand it to a 7th and 8th year. Do you agree?
Yes, I think if they're continuing to be able to operate under their current revenue, I think it should be continued. I know tuition has been skyrocketing when I was in college. Now I did happen to go to a private school, but in the time I went there, the tuition went up 50% in the 4, well actually it was 5 years I was there. So I think it's a good thing to try and hold tuition as long as it doesn't impact the ability of the UWs to provide education to the students.
Tragically, northern Wisconsin has a very serious and growing problem with methamphetamine. What are your thoughts on next steps that could be taken to fight the abuse and addiction with methamphetamine?
I think there's education and I think training and providing jobs for them. I mean, getting them away from the situation where they're, with the drugs and all that, and getting them a good job so that they aren't brought back into that environment where they would continue to use the drugs.
Part of this debate includes the bills in the Capitol that would legalize recreational and medical marijuana. Your positions?
For the medical marijuana, I would say I think we should look at that. I think it's definitely if it's can be helpful to people who are having to fight some sort of disease or whatever it is because the possible negative effects of the marijuana would outweigh the negative effects of what they're being treated for. Mm-hmm. Recreational marijuana, I'm not in favor of. I know there's debates out there that it's harmful or it's not harmful. And looking at it, I know there were some numbers that after Denver and Colorado mm-hmm.
Approved it,
that the crime rates went up. And there's debates about whether or not that was related to the marijuana. So I think, to me, I'm not convinced that it's safe yet. I think that there's negative effects, so I think we need to see what happens in the other states, and if it is proven that it's not as harmful as they say, then I would consider it. But right now, I'm a hard no.
Finally, you want to highlight differences between you and the Democratic incumbent you're challenging on November 6th?
I guess I would just say that I would work hard in Madison to represent everybody in the district. I don't have all the answers, so I definitely would want to hear from everybody and provide their voice down in Madison.
Thank you. Jeff Fahl of Phillips is the Republican candidate in the 74th Assembly District. The election is November 6th. Jeff, thanks for talking to WisconsinEye.
Thank you, Steve.
Thank you.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.